I'm Dr. Suji. I am the medical director at Liminal Medicine, and I wanted to talk to you today about the executive order, and specifically about Ibogaine that is mentioned in the executive order. So what is Ibogaine? Ibogaine comes from the Iboga bush in West Africa, and it has been used for centuries, if not longer, as a psychedelic medicine for spiritual and cultural purposes. When the psychoactive part of the Iboga plant is extracted from it's actually the bark of the root, then it is actually called Ibogaine, and so that's a purified, specific psychoactive chemical, and that's what's usually used in Western settings. So how is this psychedelic medicine used? So usually when we talk about Ibogaine, we are talking about the use of it for opiate addiction. This is a pretty widely known use of this medication. There's growing research that shows that even one dose of Ibogaine can be helpful for getting people to stop using opiates and to decrease people's desire to start using it again. So what does this treatment look like? So first, it's important to know that there are no legal Ibogaine clinics in the United States. Ibogaine is illegal in all of the United States at this point in time. And so people have to travel to other countries to get this treatment. When you start doing this treatment, or when you get to a place where you're going to do this treatment, you usually take one dose. This dose will cause psychedelic experience that can last up to 24 hours. During this time, people who take opiates tend to have to take them daily or several times per day. But during this period of time, this 24 hours, where people would usually be withdrawing and having really terrible withdrawal symptoms for the opiates, they tend to have very few symptoms. It is a very deep and intense, a very deep and intense psychedelic experience. You're just lying in bed for 24 hours. You're pretty much you're not eating during any of this time, and you don't really have much of the withdrawal symptoms that most people get from when they stop taking opiates. And then afterwards, some people do find they have very little desire to start taking them. So there's not a lot of research on this treatment, but some research shows, and there's just not a lot of it yet, that even a single dose of Ibogaine can not just reduce withdrawal symptoms, but it can also reduce the use of opiates over the next 12 months. So this would be very exciting, considering that we still do have a pandemic of opiate overuse in this country. Also, actually, recent studies have shown that Ibogaine might be very useful for eliminating or reducing some of the symptoms in Parkinson's disease, and it might be very helpful for people with traumatic brain injury as well. So this is very new research. We're not really sure where it's going to go, but at least there's some really other interesting stuff going on in researching Ibogaine. The big issue with Ibogaine, however, is that it can cause, it's a really bad side effect, it can cause a heart rhythm that is very dangerous and can result in death. Even if you are in a hospital, it can be difficult to get you out of this heart rhythm, and so people do die from Ibogaine when they're going to clinics around the world. There's a death pretty recently in the last 6 months. So really, it has to be done. You have to be screened very carefully before you take this medication. You really must be working with physicians and trained staff, and you really should be in a clinic that has all the equipment to get you out of this fatal heart rhythm if it should occur, and all the staffing equipment and medication to do that. And even then, sometimes it is possible that people will still die. It is a very exciting medication, but we're not quite there yet with the use of it. So hopefully this executive order will allow for more research into Ibogaine and its dangerous effects, and we'll have more medicines to be able to add to how we can treat people with these different issues. Anyway, thanks for listening to us. Follow us for more information on psychedelic therapies. Thank you.